So our last speaker is, I have the pleasure of introducing, he's also a dear friend and colleague, Dr. Marcus Greatheart. Marcus is the North Island Medical Lead for Addictions Medicine. He brings a unique combination of skills and knowledge and training to his work as a family doctor in Campbell River. He has over 25 years experience as a community educator and leader and has a master's degree in social work. He works alongside some of the most complex patients in our system who are experiencing mental illness, addictions, and experiencing homelessness. In his work, he uses strengths-based and trauma-informed practice through a social justice lens, and it is my pleasure to turn it over to you, my friend.
You're all just going to have to give me one moment. My husband's, in this moment, is picking up a foster dog at SeaTac Airport, and he's just sent me a picture, which is this puppy named Buddy in a crate. So if I could project that, anyways. Talk about being present and in the moment. What a pleasure to be here with you all. One other confession before we hit the slides is I haven't seen them. I got so anxious about putting together a slide deck. I finally turned to Sarah and Carrie Ann and asked them to put together the slide deck. So all of these images will be new to all of us. All right, let's go. Let's see how this goes. Oh, that's me. All right. Hi, I'm Dr. Marcus Greatheart. I want to tell you, sometimes it's okay to say I love you to your patients. Sit with that idea. It's a little profound, maybe a little scandalous. So I'm Dr. Marcus Greatheart. I'm a social worker. I'm a physician, and I'm the family doctor to a number of our unsheltered homeless community. I started doing this work about 3 years ago when my husband and I moved to Quadra Island, and I started working in the North Island. I stepped into a locum position, and part of the role was to do this outreach work, this street medicine. And initially I found it very difficult to build relationships with my patients, and I tried to understand why. But then I thought back into my training and experience and realized we know why. A lot of our clients that we work with are Indigenous, struggling with mental illness and addiction, part of multiple intersectional marginalized communities. They have no reason to trust us. In fact, we have built systems in which we have built mistrust. I often talk to trainees about how colonization and the mistreatment of so many marginalized communities is woven into the fabric of our white coats that we are so powerfully given. That doesn't mean that we have done those harms, but our profession has done that. I'm a physician. Physicians have done that harm. I'm a social worker. Social workers have done those harms. It's important for me to recognize the significance of what our professional work has done and how it can impact the relationships that I'm trying to build with my patients. Connections were slow. People would come up to me and say, hey, I've got this infection here, could you take a look at it, sort of cautiously, and I would do something, and then maybe a few weeks later somebody would say, hey, you know what, you saw my mom with the infection on her arm, do you think you could help me out with a disability application? So I would start to get referrals. I remember coming up on one of my own patients from my OAT clinic in the alley, and I just sort of boldly walked up towards them, and as I'm walking close and I'd already said hello and said their name, I realized they were just finishing fixing their substance and were just prepared to smoke it. And I was like, well, that's why you come to see me, right? So they smoked their substance and then tucked it away, and we had a conversation. It's taken time. It's taken investment. It's taken showing up on a very regular basis for these folks who have no reason to trust, to start to trust this old white guy doctor, to start sharing with me their experience and their lives and allow me to start to help them. within our unsheltered homeless community, these pods form, where groups come together to support one another. And it's interesting because typically there's sort of a matriarch within that group, and so we'll be on outreach and we'll go and support, and it's usually the matriarch to say, hey, good to see you all on outreach. Actually, this person over here's needs to restart their methadone, and this person over here, injured their knee. Could you help them out? And they're sort of taking care of folks, waking people up to say, hey, get up from your nap and talk to the doctor. And after we had done that a few times, I realized that sometimes as we were walking away, they would say, thank you, love you guys. And that put me into a really interesting professional situation, because when someone says, I love you, you kind of want to respond in a similar way. But all the talks about self-disclosure, professionalism, propriety of the physician in the doctor-patient relationship really came up to me, and I thought, you know what? They're not saying I love you in a romantic way. What they're saying is, I'm starting to trust you. I'm starting to connect with you. And in that context, that's what gave me the confidence to turn over my shoulder and start saying, love you too. Because it's taken 3 years to build that degree of trust. Working with our unsheltered homeless community is some of the most meaningful work I do. And I had a conversation with our medical leadership who I work with, and said, I loved my work as an addictions doctor, but the work that we do in homelessness care is so immediate. It is so patient-centered. It's like, what do you need? They don't care about an A1C being on target. They're like, can you give me a sandwich? Like, I'm kind of hungry right now. So I put that away. There's a great book called Compassionomics by Mazzarelli and Treziak, and one of the important messages from that I continue to live with is that compassion is empathy in action. The risk of practicing pure empathy is burnout, because you're taking all of that experience and feeling in, and it's stagnant within you. But when you're able to convert that into advocacy, into care, into practice, that makes such a profound difference. And there's evidence to show that not only supports our patients, but it fills up our cup. It is burnout prevention. Personally, I also think that compassion is the strategy that we need to fix the healthcare system. If we're able to practice compassion with our patients and with our colleagues in the everyday situations that we're in the difficult situations that we're in, and if we're able to practice that in leadership, that is how I believe we move forward to effectively improve our healthcare system. How am I doing? Killing it? Oh, how am I doing for time? Rainbows. How did you all know? I got nothing else to say. Covered all the material I wanted to share. Look at that. Those are some great hearts right there, wouldn't you say? I appreciate your attention all today. It was a real pleasure to be here with you all. Thank you for opening up. And I look forward to chatting with you some more as well. So it's been a wonderful day. And thank you to the wonderful, can we give it up for the wonderful Dr. Sarah Lee here and her team? We're going to get you a coach's whistle, because whenever you call yourself a coach, I think of you like our colleague over here is, running the athletic team that is at the doctor's.
I know he was telling me I should have a whistle so I could get everyone back in the room on time. Thank you, Marcus. What a great way to end our PK conversations. So, and thank you for your generosity and vulnerability.